designing very complex products, buildings, cities. What's different here is we're taking the same tools, the same kind of thinking process, and applying to much more complex social, economic types of problems to get a better handle, an important handle on the big picture, you know, of systems and the systems in our society and how they interact and interface with each other. And also designers, we like working in teams, as Tenley mentioned. It's part of the nature of my training. We need to collaborate. We need a lot of different experts. These problems cannot be solved by one discipline alone. Our society is demanding now teams of experts working in collaboration to understand, one, the nature of these problems, you know, what is really driving the complexity of what's broken, but also coming up with new solutions, new ways to think about the problems that will generate efforts that really change the problem. And that's the other part of what we do. We like to build. We like to make things happen. And that's part of also our approach here to collaborative initiatives at MIT with our partners. Let me speak a little bit about the Urban Design Lab, which I know a little bit about. It's led by Professor Richard Plunz and Michael Conard. Professor Michael Conard at the School of Architecture led the project with Kubi. And they as we said, we'd like to partner. Tenley and I like to bring the team together and work with them, particularly on the advisors of the project. We have a number of senior people who've been helping the project, particularly get that systems perspective, the different stakeholders, if you will. And we've had people from the industry, some of you, I'm sure you know Michael Pollan and Fred Kirschman, who's here, all helping us to understand the complexity of the childhood obesity problem that Columbia worked on. But the lab is at the Earth Institute, led by Jeff Sachs, and they have a long history of solving problems on the environment and sustainability. So they were a great group, bringing in public health and economics and